Welcome back to the Able Exchange podcast. Today, I am met with Dr. Khadija. She's a consultant pediatrician and a neurodevelopmental specialist. Dr. Khadija provides care from birth to 16 years old. So she supports children with developmental, behavioral, neurological, and just general pediatric needs. Today, we're discussing a really important topic: why therapy doesn't happen alone. Why it's not a standalone thing, why it needs support. So a child might be attending OT, speech and language therapy, ABA, psychology services, but if their body's not rested, if their body's not regulated, nourished, or physically comfortable, this can directly affect how they attend and learn and communicate and engage, essentially. So today we're looking at one key question. Before we ask the child to sit, attend, communicate, learn, or regulate, is their body ready? Thank you so much, Dr. Khadija, for gracing us with your presence. It's very nice of you.
Yes, thank you so much for having me.
Amazing. Thank you so much. So could you just briefly explain your role in this sort of world for everyone as a consultant, pediatrician, and a specialist, especially with supporting children with developmental delays and autism and ADHD and therapy needs? Why and when would people come to you, essentially?
Okay. It's so important. It's so important to start from the beginning of looking at the whole child, right? So I'm not just looking at it from a perspective of diagnosis or just therapy goals. What I do is look at the child from head to toe, which is so important. As we'll go deeper into it, then you'll see why this is so important. So I look at it from a medical aspect, a family aspect. A big part of it is the family context, right? And the family dynamics and the cultural background. I feel like this is not given enough light that it should be given, because there are so many family dynamics and contexts that we have to think about. And then we come to nutrition. We come to sleep, the big ones. You cannot imagine how just sleep will fix almost half, if not all, of the problems. Right? And this is what's not focused on enough. So when I look at the child, I look at the medical aspect, yes, but I look at every other aspect that makes up a child and makes up a family.
That's amazing. Yeah.
And that's the difference.
And those are things that aren't usually looked into.
Exactly. Yeah. You would not believe how many children I see come in as a referral and say something like just a behavioral concern. And just by digging deeper into the history, I find so many red flags when it comes to feeding and nutrition. Yeah. And I always say, you cannot move forward with any kind of assessment until we fix these, because it's unfair to the child. Yeah. If the child has a nutritional deficiency or sleep deprivation for any reason, we are not being fair by doing assessments first before fixing the sleep and nutrition.
Agreed. They're not functioning at the best of their ability. So how can we assess them?
Yeah. Exactly. Yeah. So what is the point? You're going to get this child that's not at their best, and you're going to do an assessment and judge them on that. I think that's really unfair. And that's why, for me, from head to toe, we do a whole child model.
That's amazing.
We don't look at things separately.
And it makes sense. You don't do a 100-meter race when you haven't slept properly last night. So it makes sense, right? Yeah.
Exactly. If you're not sleeping well and you're chronically sleep deprived, or you're not getting the nutrition, you feel fatigued, low energy, you're irritable.
It's so true. There's so many more facets that aren't usually looked into, and it's amazing that you're there and you're shedding some more light into this area.
100%. I think more people, even doctors, need to know this. That, the thing is, those quick appointments are not enough anymore. We really need to. For me, it's not just about symptoms. We can't just look at symptoms and treat them. We need to find root causes and treat them from there and move up. And that's especially important in child development.
Very true. And thank you for gaining more traction in this field. And I feel like it is sort of, sleep apnea is becoming more of a thing.
Exactly.
Sleep studies are becoming more of a thing.
I am so happy that this is becoming more, and people are talking about it
100%, more. And that's amazing. And thank you for that. Appreciate it. So could you explain what, other than assessing a holistic, what a neurodevelopmental pediatrician usually does in terms of assessment or things like this? Because it's a big umbrella term, I feel. You don't only focus on sleep. You don't only focus on nutrition as well. Like people come to you for a whole wide array of, say, disorders and things like this. So you do assessments as well?
Exactly. Yeah. Exactly. So apart from general pediatrics, which is my cuffs and colds, so when a child comes to me, so in my developmental aspect of my practice, what happens is that if you have any kind of behavioral concerns, learning difficulties, the school has raised a concern, the parents are having some concerns at home. So then that's when the child would come in. We would first dig into a deep dive history taking, which is the most important aspect of this, is your deep dive history, complete history from birth until current, right? And family histories as well. So history is the biggest part, and then clinical examination, and then from there decide our developmental pathways. So when we go into the developmental pathways, we go into development, behavior, learning, depending on the age of the child, right? So in our early years, academics are not our main aspect. We have to look at developmentally those domains of development. So when we look at the domains of development, we're looking at foundations of learning, motor skills, social, personal, emotional. We're looking at communication skills as well. And when we look at communication skills, it's really important to talk about speaking skills and non-speaking skills as well. It's important to talk about, is the child receiving the information, which is the receptive, and the expressive, are they expressing it well enough, depending on the age. So essentially what I do when it comes to development is build a profile of the child. So I'm not just there to give a diagnosis. Of course, in some situations, diagnoses are important for school, for the family, for therapies, to guide therapies, etc. But it's not just about the diagnosis. So yes, you will get a diagnosis if there is one, but my biggest part is creating a skill profile. The skill profile will tell me where this child is at, where they should be, where they're at, their actual age versus their developmental age, and then take it forward from there. And then I always tell families that I'm not going to start where I think your child should be. I'm going to start where your child is. And that's the importance of building a skill profile, rather than just, here's your diagnosis, congratulations, there you go, off you go. It doesn't make sense, because how are therapies guided if you don't have a skill profile for this child? And that comes into how the brain is wired. And each child is genetically different. Their temperaments, their innate temperament is different, and based on their environment and the family context, their personalities differ as well. So if a child is high energy and I'm going to try to just make them sit down and do things without knowing that, okay, this is a high energy child, this is a sensitive child, this is a calm child. So without knowing how they are innately and their temperament, and then seeing their personality and seeing what skills they can or can't do, how am I going to individualize that support and give them the right effective support? So that's where development is for me, is not only looking from head to toe and the medical aspects of it and the biology of it, but looking at the child and the brain and the way it's structured and the way the child, or who is this little person in front of me?
That's amazing. Right? That's amazing. It is truly multifaceted. It actually is. And the only way you can focus on the strengths is if you know the weaknesses. That's it.
Exactly.
Right? That's right.
100%.
And I completely agree with you. So true.
Exactly. So you're going to use basically the strengths to build on the weaknesses, right? And we all have them. We all have strengths and weaknesses. Some are a little bit more, some a little bit less, but we all have them. And so what we end up doing is that the word compensation comes in, right? And we do this throughout our lives, is we have weaknesses as human beings. We have weaknesses, we have things that we're unable to do, and we compensate for them by doing other things or using our strengths and work on the weakness. Now, if we don't do that when it comes to development, what's the point?
What are we doing?
What's the point?
Yeah.
You know, because we need to help these children use these strengths and build on, you know.
And that's what we do as humans, right?
Difficulties.
Yeah, we focus on our strengths as humans.
Exactly.
I'm not really good at tennis, so I'm not going to play tennis. It's quite,
exactly. Exactly. And I love that you raised that point.
Yeah.
Why do we have different standards for children than we do for adults, right? Why is it such a double standard? And these are little brains that are growing, still trying to figure out their place in the world. And here we are as adults. We don't like to do something, so we don't do it. But yet we'll force a child to go ahead and do that.
Yeah. Why? Yeah, why?
Because I still don't understand.
No, it's so true.
And the thing is, I was probably one of those people in the past. I mean, being a parent myself, and you know, it's you learn more, you know more, you do better. Yeah. Right? And that's what it is about. It's about progressing and understanding that we may not know everything, but we can learn and do better.
And we can do better. Yeah, that's amazing.
Right?
And that's brilliant. That's brilliant. So following on, when we say a child's body needs to be ready for therapy.
Okay.
What does that actually mean? Like in layman's terms, how can a child be ready for therapy?
Okay. I love this. We can go on and on about it. Yeah, I really like this question. Yeah. Why do we need a child to be ready for therapy? And what does it mean that their body needs to be ready? Right? So to accept anything in our environment, our body needs to be ready. So biologically, mentally, we need to be ready for it, right? So to accept learning and to grow and to develop, we need to be ready. And so therapy and the human body and biology, they go together. They go hand in hand. You cannot pick apart and say, okay, therapy is this, and then biology is sitting on the other end of the room. It doesn't work like that. They are so tightly linked because it's one body. What is therapy doing? Therapy is restructuring connections, right? So you're restructuring connections, you're building connections. And so in order to be able to do that, don't you think that the biology of the body needs to be ready to accept that? So when I say the biology of the body, so is our nutrition there? Are we getting nourished? Are we receiving the vitamins and minerals we need to from our daily diet, our food? Are we receiving adequate nutrition? Are we getting enough sleep? Right? Because sleep is a big factor, and I think we're going to go into this after some time, but sleep is a big factor, right? Are we regulated enough? Is the emotional center of our brain ready to be frustrated and calm down after that, or be able to regulate ourselves? Now, when I say regulation, I'm not saying self-regulation, right? There is a big difference between them. So I'm talking about regulation in general. So our cells of our body have to be ready to grow and learn and connect, right? If you have any type of deficiency, you're going to be fatigued, you're going to be irritable. If you have constipation, you're going to be irritable, you're going to be in pain. If you're sleep deprived, you're going to be in pain. Your sensory system is going to go in overdrive, right? So again, is a child that is sleep deprived, vitamin deficiencies, if they have any physical pain, such as a tummy pain from constipation, do you think this child is going to sit and learn and accept what you are trying to help them with? They're going to be there, they're going to be irritable, moody, low energy. It's not going to work. How are you going to accept that? The brain is not ready to accept that. So if you don't fix these things, remember that the human body biology is based on evolution. It's based on survival. It's based on a protective mechanism. If you have pain, if you don't have energy, you go into hibernation mode. Your body needs to conserve what it has to be able to survive. So historically, or evolutionary wise, it would be running from predators, right? So we needed to conserve. When there was not enough food, we needed to conserve that energy to be able to have the energy, the burst of energy when we needed it. So remember that our bodies have not changed in that perspective. It's still survival, it's still protection.
Innately, it's still the same.
It's there because that's what survival is based on. That's human survival. That's how we survive in the world. And so if we don't biology wise, if we don't optimize everything, we're going to conserve, and we're not going to accept any kind of, in this case, therapies that you're going to give.
100%. And that's quite important, because many people don't acknowledge how tiredness and pain and hunger and constipation and general poor regulation can affect how a child performs in therapy. There's not that much awareness on it. Yeah.
And studies have shown that constipation and behavior actually have a bidirectional association, which means that behaviors can cause constipation, that is behaviors being either withholding or diets, etc. Constipation can affect behaviors and can cause behaviors that challenge as well.
So everything really is.
Exactly. This is the thing. It's interconnected, right? So those same behaviors that a child may be struggling with and you're trying to help them with, if you don't fix the connected issue, it's not going
to work then, is it?
Exactly.
Yeah. So that's the actual moment. That's what it means. That's what it means for a child's body to be ready for therapy. Yes, exactly. So I think that's an important point, because like I said, we always focus on the therapy session itself, but the child brings their whole body into the session.
Exactly.
Okay, it's not only their mind, it's their sleep, their energy, discomfort, nutrition, sensory regulation, emotional state. There's a whole load of things that we look into. So can a child's body affect how well they respond to therapy? So what you said makes sense. Well, but if we have two children, okay, and they receive the same therapy, the outcomes would be very different.
Yes. 100%.
Yeah, exactly. That's the end. And that's what we're trying to sort of instill. Like, there's no one size fits all here. You know, there's no copy paste sort of cookie cutter method, right? It's one child could be better regulated physically, and another child could be less regulated physically, for example, right? So it's completely different, right? So can the body affect therapy process? Yes. Exactly. So what we're trying to essentially portray is that more therapy is not always the only answer. That pushing more sessions a week is not the only way to progress, essentially, right?
Exactly.
Yeah. Exactly. So sometimes when progress is slow, my thought is often, and loads of the parents' thought is often, let's put another session a week. Yeah. Oh, I think we're doing 2 sessions a week. Let's just do 3, or let's do 4. And sometimes the question should also be, is there something affecting my child's ability to benefit from the therapy as much as they can? I think that's something that parents should really look into. Rather than adding more sessions, is how do we make current sessions more efficient and more progressive, essentially. So moving on from that, sleep. You mentioned sleep. Okay, huge topic.
I love sleep.
It's a huge topic.
It's a huge topic. We will not finish this today.
Okay.
Talking about sleep.
Okay, so let's touch the surface.
Let's touch the surface of it.
So can poor sleep make a child look inattentive? How can sleep affect the therapy progress, essentially?
So now, let me start with, if you slept late, you went out, and then you slept at 3 a.m. and you're going to wake up at 7 a.m. How do you feel?
Oh, I did that yesterday. It was awful. Yeah, it was not great. I was in one ear, out the other.
Exactly.
So,
the body is not ready. Why do we sleep? Let's start with that. Why do we sleep? That's our brain's way of, although the rest of the body shuts down, the brain becomes more active during sleep, because sleep is the time where memories are consolidated, where toxins are washed out from the brain, where, everything that's happened in the brain during the day, the brain is processing it. Repair hormones are being released, so the body is being repaired, the immune system is being boosted, everything is being cleaned up. So it's basically like the shop is open during the day and the shop closes at night, and we clean up everything, we organize everything, and we shift everything around, make sure everything is ready for the next day and the exposures that you will have in the next day. So this is sleep, and sleep is so important. Now, numerous studies have have associated sleep deprivation with things like inattention and hyperactivity, right? And so this is whenever we talk about hyperactivity and inattention, ADHD. That's the biggest thing, isn't it? And I can't tell you the number of times I have had, especially recently, I've had families come in for behavioral concerns of hyperactivity, and they want an assessment for ADHD, and they said, I need an assessment. I'm coming here today for an assessment for ADHD because my child is hyperactive. They don't want to pay attention in class. I'm getting complaints from the teachers. And I tell the parent, we'll get there. Let's take a step back first. Let's look at sleep and nutrition first. And then we move forward from there, right? And so sleep affects parts of the brain, right? So the biggest, although it affects multiple areas of the brain, there are three main areas that we know that it affects. The first is the prefrontal cortex, right? Which is front of the head. Which is the front part of the brain, which has to do with our reasoning, our decision making, our impulse control. So sleep firstly affects the prefrontal cortex. The next thing that it affects is what's called, which is a word that it takes a bit of time to say the word, but the amygdala, right? Our emotional center of the brain. It affects. Sleep deprivation affects the amygdala. Imagine your emotional center just getting riled up because of sleep deprivation, right? The next center is the hippocampus, right? Where our memories are formed and consolidated, right? And so what have I essentially told you about the parts of the brain that are affected? Impulse control, decision-making, emotional regulation, right? And memory. Wouldn't you think that these all come under parts of the criterias of ADHD and the intensity of them? So sleep deprivation can mimic ADHD, and it can also worsen or make the traits appear worse in those with ADHD, right? So we have to really think about how much sleep affects. Do you know that 24 hours of sleep deprivation can increase the reactivity of the emotional center of the brain by 60%?
Wow.
60% just in 24 hours of sleep deprivation. It blows your mind to think that what is expected of someone that is sleep deprived, their decision making and their impulse control is reduced by up to 30%. So again, we have criteria for ADHD and we have mimickers of ADHD, and we really have to be careful because those traits or those symptoms of sleep deprivation can be so intense they can look like ADHD and they can even fit the criteria, right? Depending on how severe it is, whether it's an acute sleep deprivation, it's a chronic sleep deprivation. But we know, after everything we know about sleep and why sleep is important and what it can affect, the parts of the brain it can affect, it tells you how careful we need to be when handing out ADHD diagnosis. Definitely. Unfortunately, I do see a lot of families come in where they have received an ADHD diagnosis, but nobody is talking about the sleep. Nobody has been spoken to about sleep. This is the first time we're hearing about it. But okay, even if you were given a diagnosis, I'm not going to take it away from you, but the traits, if you do have ADHD, it's going to worsen your traits. So again, if you're going to do any kind of therapy in ADHD, is your body ready to accept that therapy if we don't fix the sleep? Because the traits will be much worse than they actually are. And so you will really struggle with that. And so this is why we need to deep dive. And I have, again, because I've seen this time and time again, I've seen so many families over the years that I've been practicing. And again, I see families come in and they tell me that, my child is sleeping enough. My child sleeps 12 hours a day. And just like, okay, I'm happy that your child sleeps 12 hours a day, but how is the quality of the sleep? So quantity no longer matters. If you're sleeping 9 hours a day and you only talk about quantity, I'm not interested in the quantity. I am interested in the quality of that sleep. Is the child moving a lot in their sleep? Is the child waking up to go to the bathroom frequently, or even bedwetting? Bedwetting can be a sign of sleep so sleep deprivation, and the quality of the sleep is not good.
Right, yeah.
So again, bedwetting is another issue. It may sound medical, but it's actually it's just the sleep that is affected. And so this is why it's so important to get a thorough workup. I go deep dive into the sleep. I don't just ask how many hours is your child sleeping. There is a whole list. I actually have a form that parents have to fill for sleep and nutrition. There is a separate form. I've created a form where they have to fill it up, and then I look at each factor and how frequently occurring. Is it nightly? Is it occasionally? Is it often? How frequent? I look at the frequency of the symptoms as well. And that will sort of give me an idea of, how intense is the problem and how big of a problem it may be. So it's really important to have these screeners.
Definitely. And that's something that's not always, like we said, not always talked about. People don't actually, it's a very important point you said regarding the quantity of the sleep as opposed to the quality. 9 hours of tossing and turning or 6 hours of a proper REM sleep is very, very different things. Right, and I noticed that with myself. When it's too hot or it's too cold, the AC is not working as well as it should be, I don't get a good night's sleep, and then the next day we're all groggy. Even though I've slept 8 hours.
And I love that you said that, because temperature of the room
is huge.
Can affect your sleep quality.
So what would be the optimum temperature?
So again, for children, the thing is the optimal temperatures we're looking for is at least 20 to 21 degrees. And I get a lot of parents with this fear that, especially their small babies, they're like, but it's too cold for the room. The thing is that, again, make sure that your child has their onesie on. However many clothes you are wearing to sleep, your child will need one more than that, or your baby would need one more than that. And that's the rule we usually follow. And I tell parents, high temperature or increase in body temperature and environmental temperature can not only disturb sleep, it's actually been shown to increase the risk of SIDS. Right? So sudden infant death syndrome. So again, having lower temperatures will not affect your child in the way you think it will. Yes, keep your baby warm. You don't want them to be cold at night, but whatever you're wearing, they need one more of that.
Interesting. That's an interesting point, and that's brilliant. Following up from how ADHD can affect the sleep and how sleep can look like ADHD and vice versa, can low iron, low vitamins, things like this affect the child's mood and energy and sleep as well?
So this is a big one. Again, another big one, let's say. So this is coming under the nutritional part of it, right? Our bodies, our biology works on nutrition. We have to have optimal levels of vitamins and minerals in our bodies to be able to function. Why? Because the metabolism of our body, the metabolics, the way it functions, the cells to function on a cellular level. So any kind of deficiencies will slow the body down. Now, any kind of vitamin or mineral deficiencies don't necessarily cause the developmental differences. Let's be very clear about that. They may cause subtle differences, yes. For example, the subtle point differences that you'll find in iron deficiency and IQ, right? So you will have those point differences. I'm talking about in a larger scale or in the context of therapies, for example. If the body is not optimized from that level, we're not able to function in the therapy sessions. For example, iron. Iron is a huge one, right? When we talk about iron deficiencies, iron is needed for energy. Iron is needed for the insulation around the nerves that make signals go faster. It's needed to create those. It's needed to create the brain chemicals, right? So again, if we're iron deficient, what happens is that the body is fatigued. It can't function because the thing it needs to function is not available. We do have storage, but what happens when that storage starts to finish? Then everything just starts to go low. And again, what I see a lot of the time is when blood is collected, and it's very hard to do in children, you don't want to prick them multiple times. Collect the right parameters and interpret it properly. So iron is needed, is such an essential part. If iron deficiency is there, you'll have irritability, fatigue, mood swings. I mean, this is a child that's going to come to therapy and is irritable. Are you going to get anywhere? No, you're just going to be fighting with the child, right? And we don't want that. That's not the goal.
Definitely.
Vitamin D. Oh my, huge. Vitamin D is in this part of the world.
Huge.
More than half of us are vitamin D deficient, parents and children alike. Vitamin D, it's really a misnomer when they call it a vitamin. It's such an essential part of, from head to toe. Vitamin D is a brain steroid, basically, right? It helps, again, with the nerve connections, the nerve chemicals. It's there for energy. It's there to boost the immune system. Vitamin D deficiencies have been related to long-term risk of diabetes, so type 2 diabetes, and increased risk of allergies as well. So you can see that vitamin D is such an important part of the body that when we say, listen, we need to test for vitamin D, believe me, it's important, especially in this part of the world where it's so prevalent. Vitamin D deficiency is so prevalent, right? And as a standard, I like children to be on a maintenance dose, at least a maintenance dose. If they don't want to do a blood test for it, at least take a maintenance dose of vitamin D.
Fair enough,
Vitamin B12, tons of research on vitamin B12. It is a nervous system vitamin. So it has so much to do with the nervous system, and it's implicated in multiple mental health conditions. So vitamin D deficiency is implicated in multiple mental health conditions. And so we really need to keep this in mind, that if the body is not optimized from a nutritional aspect, and listen, the food we're eating now, let's talk about that for a minute. The way the food is produced nowadays is that
strips.
Exactly. It's really stripped of a lot of the vitamins and minerals that it would naturally have for many reasons. High yield, dilution effect, all of these things. So the crops that are coming out now and the food that we're getting on the shelves, especially because they're transported over distances, right? So the way they harvest them is different if they're going to be exported and imported, right? So we need to take this into consideration as well, that your diet could be perfect as well, but if you're feeling symptoms of low energy, irritability, or if you see your child has more behaviors that challenge than before, say your child is suddenly starting to get more irritable, look at this aspect. Look at the vitamins and minerals, because that's the biology of the body. And that's another key aspect of getting the body ready for therapy. And I just want to touch on quickly that the right blood test and interpretation has to be there.
That's the most important thing.
Exactly. Listen, lab referencing is not enough anymore. We find that there's the lab referencing for what's considered optimal, and then we have the functional level of optimization. So for the body to be able to function at a particular level, say to accept therapies, we need say ferritin or iron levels to be at a certain level. And that's where we're optimizing it functionally.
That's important, because when people do blood tests, they check, is it the minimum? But is that as efficient as you could be?
Thank you.
That's an important point.
Thank you. It's no longer enough to collect standard values and interpret them in a standard way, especially in pediatrics, especially in neurodevelopment. So the way we look at the test functionally is very different from general pediatrics. So going through general pediatrics, there is one way to do it. Going functionally and neurodevelopmentally, completely different.
We're testing different things, right?
Exactly. Even the type of tests we collect, very different from standard testing.
That's a very interesting point.
Hi. This conversation with Dr. Khadija was too valuable to fit into one episode, so we've decided to split it into two parts. This is the end of part 1, and see you in part 2. Thank you.